finance committee meeting where he had some insight into our one decision item for this evening. So I'm sure he'll be able to follow. Hopefully he will be able to join us. Why don't we'll call the meeting to order. And Teresa, if you go through and do the roll call, make sure we have who we have online.
Okay, Steve.
Present.
Noel.
Here.
Rita's here. Michelle.
Here.
Okay.
Okay. And let's go ahead and approve. I'll take a motion to approve the agenda.
So moved.
I'll take a second.
Second.
Okay, it's been moved and seconded. Has everyone, all those in favor of approval of the agenda, please say aye.
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 Or any opposed? Any abstain? All right. The agenda has been approved for this evening. I'll take a motion to approve the minutes from last meeting.
I move approval, but I have a change. It shows that I made the motion and second the motion
Oh.
Oh,
at the same time.
Oh.
So that probably doesn't work too well.
Sorry
I
about
missed
that,
that.
Steve. Steve, which
It's
the first
It's-
one on there.
oh,
approval of the agenda.
okay. Thank you, Steve. I'll correct that.
Okay.
Okay,
So I move approval with that one correction.
Okay.
thank you. I missed that one. Okay. Do we have a second?
I'll second. Noel.
That's Noel, so you can get a second. So we have a motion and a second. Has everyone had a chance to review the minutes? Has anyone not had a chance to review the minutes? Okay, it's been moved and seconded. All those in favor of approving the minutes from last meeting, please say yes.
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 Yes, or I, or whatever.
Okay. Any abstain? Any noes? Any nays? If they no? Any abstain? Okay. The minutes have been approved. We come up on to our only decision item for this evening. We have a whole lot of stuff to inform the board about, but we have one decision item that's a pretty major one. We're coming up on our final budget for our year, for our library fiscal year. And the part of the process of what we do is we address the personnel budget first as part of our total budget. By the time we get to approval of the total budget, we've had the opportunity to look pretty much in detail at each component of the budget, so that the final budget will be looked at and presented and adjusted by the finance committee. But as personnel costs and expenditures traditionally and what we anticipate comprise about 60% of our total budget. So it makes sense to start there. I'm sure Steve has a complete presentation on this, so I will let him take it from here.
Okay, so if we can go to the next slide where we have our projection of revenue, and I know this is a little small, but I know a lot of you have the handout in front of you. This is where we start, like Joycelyn said, and so if you can see, these are actually several columns from our 25-year report and estimation, and you can see the dark line that runs down the middle of the screen, and everything to the left of the line is actual up until fiscal 1920. And then of course we're in the last quarter of fiscal 2021, which that's the first column to the right of the line. And then the next column is our estimates and proposal for 21-22, which is what we're talking about tonight. So in terms of our operating tax revenue, we are, Quan and I and the whole team have been looking at this, and we feel very confident that we're going to meet this projection of $60.5 million. It's, if you remember from last board meeting, we were over 100% in 2 of our 3 counties and coming up real fast on our 3rd county. So we feel like we're going to make this number. So accordingly, what we did is we've looked at our proposed revenue, tax revenue. This is when we do our estimates, we do our estimates based usually on what we project our levy is going to be. Our current levy is 36.96 cents per 100 of assessed valuation. That's what the levy is this year. And we expect our levy to be the same amount next year, 36.96. And so using that levy and looking at some of our general revenue increases, which our revenue increases have averaged about 2.4% through new construction, new building, things like that. We're projecting a revenue increase from 60.5% this year to 61.6% next year. So it's a small increase, not a significant increase. We look at our other revenue sources. We expect that to hold the line, be about the same. The next thing that we do is after we've estimated our revenue, then we take out the amount of money that we plan to transfer to the capital project fund. In 21-22, we're actually planning no transfer to the capital project fund. And the reason why is because the finance committee is actually recommending a $4 million transfer. This gets a little complicated, but in 2021, the finance committee was supposed to transfer $2 million, and they decided not to because of the pandemic. What they're going to recommend at the upcoming board meeting is that we transfer that $2 million, and then we also transfer the planned $2 million from 21-22, but we do it all in one fell swoop this year. And so accordingly, we wouldn't have to increase, we wouldn't have to do any transfer this year. So that's why that's showing at 0. The next line is is the amount of money that we transfer for our debt service. And that debt service transfers $6.6 million. And so then once we subtract that out, then our operating total is $56.1 million. And when we look at $56.1 million, we do our target allocation, as Joycelyn said, a ceiling of no more than 60% for personnel, 22% for material expenses, and 18% for operation expenses. So our target allocation of 60% for personnel works out to be $33.6 million. For materials, it works out to be $12.3 million. And for operations, $10.2 million. And then you go down to the next line, and it shows that that as things are working out, our ending and unassigned operating fund balance is projected to be $27.3 million, which equals 47.4% of the amount of money that we need, 47.4% of the total budget amount. And by policy, our ending fund balance should be somewhere between 42 and 48%. So we're toward the top end of that. But basically that's the money that we need to get from the end of one fiscal year to the beginning of, from the end of one tax year to the beginning of the next. And so, no, I said it right the first time. I'm sorry, I got that backwards. It's from the end of one fiscal year to the beginning of the next. And so we sort of have to live off our savings account for about a 6-month period. And that's the money that we have to put away to do that. Now, everything below that, when it goes from green to black, is talking about the capital project fund. And I'm not going to go into that for tonight. That's just another part of this. But it does show how we continue to pay off the capital projects and pay for our capital projects. So the big news for tonight, or the target for tonight, is that once we figured out our revenue projections and how and paying off debt service and things like that, then we know our percentages, our allocation for personnel. And as I mentioned, our allocation for personnel, 33.6%, $33.6 million. And so what I'd like to do at this time is go to the next page, which this actually goes through the way staff is recommending that we spend that $33.6 million. Before I do that, I want to pause for a second and make sure that everybody's comfortable on how we got to our revenue number. And once we're comfortable there, then I will let Jennifer talk more about the specific lines, and the two of us will walk through those lines for everybody. Oh, hearing nothing. Do we have any questions? Nope. Okay. So what I'd like to do is, Jennifer, if I could turn it over to you and let you start walking through the spreadsheet. And
starting with my mistake.
Okay. Yeah. Let's start with the mistake.
With the mistake, we do want to point out that there was, when we talk about how many benefits eligible FTEs that we have currently approved and how many that we need, the number is off by 1. So the total authorized FTEs is 413 on this spreadsheet, but it should be 412, and which would make the following number 418.
So if you go down, so it's active benefits eligible, then authorized but no incumbent, and then the next line is
Should be
2020, 2021 total authorized. It says 413, but should say 412.
correct.
Right.
Okay, so we'll just kind of go line by line. We have a pretty significant difference in how many folks we had on board this year versus last year. So those the salaries for those folks that are on board is just a little over $17 million. For the open positions that we have that are currently unfilled is another $1.5 million. And then we are requesting and asking for an additional 6.5 FTEs, benefits eligible FTEs, in order to get ready to staff to be open for all 3 Lee Summit branches to be open. That's a partial year, so that $120,000 on that line is to help pay for the benefits eligible staff that we need added in Lee Summit towards, about probably getting close to around this time next year. So that's where that $120,000 comes from. The next piece there is.
So let me make sure that people fully understand that. So there's a lot of, if you look up that authorized but no incumbent, there's a lot of people, there's a lot of authorized, 48 authorized positions that we don't have filled. And then we're asking for another 6.5. And you might be saying, well, that doesn't make any sense. Keep in mind, we just lifted the hiring freeze. So we went about a year without hiring people because it was the prudent thing to do given the pandemic. We're working to get those things filled, but it takes a while to get those filled. And then just to reiterate, that 6.5, remember, we built a brand new unit of service. East Lee Summit did not exist several years ago. And we've been sharing staff. Right now it's staffed by Colburn Road staff. Colburn Road staff's getting ready to go back home. The Lee Summit staff is going to move over to East Lee Summit when we renovate their building. And when the Lee Summit staff moves back home, someone's going to have to go to that East Lee Summit branch, which that's where this is coming from. It's eventually we had to hire new staff when we built a brand new unit of service. So I'm sorry, I'm kind of really driving the point home, but I want to make sure that people understand what we're doing and why we're doing it.
We want to be able to have someone in that building when it's open and ready to go.
Yeah.
Yes, and if I may drive the point home even further, it may seem like a big number, but we're also looking at an area of our service area where we have the top branch, the third top branch, and now a new branch where we don't know where they'll fall. But I believe it's something like 1/10 of all of our circulation goes through the 2 branches, and now we have a third. So it's a pretty significant investment. It's all also our Coben Road branch will be one of our new destination libraries, which would be more of a library center. So if you look at that number, you need to take that into consideration as well. That's that.
Hey, I have a question, and I'll be honest, I haven't looked over this carefully as I should have. How many for security, like in those new positions we have? I know we added somebody to help Dustin, but this is going to end up being something like where Diana's office ended up growing and stuff. I mean, I think we're asking an awful, do we have extra security people put in that for the hiring or no?
Currently, the unfilled FTEs that we have, we are in the process, it's actually a continued process at this point, of capacity evaluation before we fill any benefits eligible FTE. The security department is one that we've talked about. So potentially the answer is yes, but I can't give you a definite yes right now. Again,
okay, I guess we're growing and we're asking an awful lot of that department in this climate for 1-2 people to handle for all those branches. So I mean, just think if we have the money and we can do it, I feel like, and if now's the time where we're discussing things, I think we need to talk about adding, if there's something we can do in that.
And that is one of the things that we've talked about as on the senior team in terms of when we're reviewing which positions we're going to fill. Sometimes, we have an opening that doesn't need to go there anymore. It needs to go somewhere else. So that's that net add of 6.5 positions potentially could include adding to security. I don't know that I can necessarily commit to it because that's not, it's a team decision, but it is under review currently. So. Excuse me. The next line item is adjustment to the pay ranges. So the minimum wage in Missouri is going up again this year. It's going to continue to go up for the next couple of years. And so we're trying to stay a little bit on track with that, particularly at the bottom end of our pay scale. So we're proposing that we adjust the pay ranges by 2.5%. The adjustment to minimum wage is actually more than that if you go out and look at it. But we're recommending an adjustment to the
I hear nothing.
Me either. I don't hear anything.
Yeah, we lost the boardroom.
so
Hold
the
on.
cost. Go ahead.
Jennifer, we lost your audio. Would you repeat that? I apologize.
That's okay.
This is Cody.
Nobody wants to hear me anyway. The line there for adjustment to pay ranges, we are trying to track with minimum wage. It's going up the next couple of years still here in Missouri. The increase is probably a little more like 4.5%. We are proposing an adjustment to the pay ranges of 2.5%. So moving the pay ranges 2.5%, and then making a market pay increase for staff members, benefits eligible staff members that are below a certain comp ratio. So on their pay grade, so that we can, so that we don't have compression at the bottom of the.
Jennifer, we lost you again. Can you hear us? Jennifer?
Eligible staff to be 19,240,388, which is up 2.9% from last year. The next section kind of breaks out a little bit where we spend money for our part-time staff. So that could be pages, frontline branch associate staff. We have part-time staff in delivery services. and a couple other places here in headquarters. So the proposed staff budget for that is 5,274,820, which is up 2.4% from last year. It's a little less of an increase than for the benefits eligible. And part of that is due to, converting part-time staff to full-time staff. So that's part of what's happening as we have added these FTEs, so that we have full-time staff that they stay longer, they become more skilled and more experienced, and do a fantastic job of serving our customers.
Right. For Noel's benefit as a newer, well, and Rita as well. I mean, you've been on the board for a little while, but a newer member of the committee, that has been a direction of the board and the committee to try to go away from just hourly non-benefits eligible employees and trying to get more benefits eligible employees and more full-time employees. Better commitment, better training and things like that, like Jennifer was saying. So stability. Yes.
Yeah,
Yes.
definitely.
Thank you.
Sure.
Yeah, we'll always have those part-time staff. They're really important because, we're open a lot of hours and we have great expertise there as well. But definitely having full-time benefits eligible staff that get to spend, a lot of time learning their job, more professional at it, we see that difference.
Helps. Yeah.
The next few lines are those expenses that we do have to pay that come along with that payroll. Social Security, unemployment, we're keeping that line item the same. Social Security, is going up relative to the increase in payroll. Unemployment, we're keeping the same. May ask, this year there was some discussion about how unemployment was going to impact the budget. We are as a public entity, we are a self-insured employer for unemployment. We don't pay an insurance premium like most companies do to cover, for their staff if they are involuntarily unemployed. So we just pay the actual amount of the unemployment. We reimburse the state. Since there was so much of the programs coming out of COVID that were messing with how unemployment was going to be calculated, we weren't sure exactly what we would see on unemployment this year. We did spend a little bit more than we typically do, but through the federal programs that came out related to COVID, we did get reimbursed for part of that. The unemployment that we paid out this year wasn't due to us laying people off, but the way the unemployment system is set up, if you have a part-time employee that loses their full-time job, let's say this is their second job, and they file for unemployment, the wages that they make for the library also count towards that, and so we may pay a portion of their unemployment. It's usually not very much, but we may pay a portion of that. And since more people were laid off this year, we saw some more of that than we normally would have seen, but still under that $15,000. Tuition reimbursement is capped at $30,000. Retirement funding, the funding for our loggers' retirement pension is going up 0.5% this year, which isn't a terrible increase. The most it can increase is 1% year over year. And so that is a 6.2% increase over last year based on more payroll and then the percentage being higher. The next portion that we'll talk about is the medical insurance funding, and that is medical, dental, and vision. We are going to talk about here in a minute about medical insurance and how we're doing.
Yeah, our experience
and how we're doing. But that line item for medical insurance is actually coming down from last year, and it was a little bit down the year before. If you've seen in the board meetings, the health insurance fund is above the ceiling according to the policy. And so we are budgeting less funding for medical insurance this year so that we can bring that health insurance down, spin that health insurance fund down so that it is compliant with the with the health insurance fund policy. Our plan has performed better than expected, so we'll talk about that here in a minute and how some of the ways that that's happened.
Jim, could I ask a question?
Yeah.
Pardon my interruption, I'm sorry. The Mosier court ruling that happened in Cole County, I think yesterday, did it have any effect on us?
I don't even know what that is. I don't think so.
Yeah, Steve, to be honest, I was on a tour all day yesterday with Michael, and so I didn't see the details of it, but generally speaking, anything that happens with Mosier's does not directly impact us, but
Okay, yeah.
we'll dig into it.
Yeah, it was a big number. It was $17
Yeah,
million.
yeah, typically loggers is separate. The statutes related to loggers are separate from the other retirement systems in the state.
It's a real good answer.
Yeah,
The firewall between those.
Yeah.
Yeah, that's great.
yeah.
Okay, thank you.
Our dental and vision insurance are remaining the same. They are, our experience has been good on that. And we also have been able to save some money this year by renegotiating our dental contract. So even though there may be more covered members, we still are running flat there, which is good. But by decreasing the funding to the medical insurance fund, that brings that line item down by 6.5%. The next line item is for ancillary employee insurance coverages. For benefits eligible employees, we pay for long-term disability, life insurance, and accidental death insurance. And we changed vendors this year. On January 1st, we renegotiated and went out to market to look for a reputable company with a good quote for our staff. We haven't changed vendors here for a while, but we were able to save a significant amount of money there on long-term disability and life and accidental death insurance. Part of that came the switch to Unum. We did get some money savings back by they were partnering with Blue Cross, and we are taking advantage of that. And you can see that that savings there of the cost of that going down by 36%. The next line is for our employee assistance program. So this is we currently use New Directions. This is where our staff can access counseling and referral services, which has become, and they've become a really invaluable partner to us this year, but they have throughout the years. They also provide management training and webinars for staff on a variety of topics. We pay that based on how many covered staff members we have, and that is going down a little bit because of the reduction in staff that we've seen with the partial hiring freeze this year. So.
And we can talk a lot about this, but I mean, it was invaluable. I mean, with the amount of stress and uncertainty that everybody had going into COVID, our employees and their families were calling our employee assistance program to figure out coping mechanisms and things to do and just how to deal with it all. But they've also done things like, for example, when we have a unexpected death in a department, somebody just unexpectedly dies, New Directions will send a team out there to help their coworkers kind of get through the situation. It's been a very, very, very valuable tool. So.
One of the ways that New Directions helped us this year was when we were going through that COVID peak back in October, November into December. New Directions, we partnered with them, and they came in with a facilitator and did small group sessions with managers to help them do a little bit of discussion and small group work on how to help support them and their staff through what was going on, all of the stress and pressure related to COVID, whether it be family issues, work issues, personal issues. And those were, managers felt really positive about doing that and felt really supported. And New Directions did a fantastic job at that. We made it small so that they could have discussions. And we did those at the end of November going into the first part of December. So it's a lot of bang for our buck for that particular line. The next group of expenses has to do with just HR administration. And you can see there what some of those items are, covering background checks, cost, the fees for the 457 retirement plan, section 125, staff development day, which is a training event that we do every year, management development training and consulting, which is very important. We are working on our next series for that currently. Job certification training, which comes up sometimes, but it can come up when, for instance, the last time we used it was to help someone get the CDL in order to drive the reading rocket. So that's one of the ways that we spend that. Exceptionality is our employee recognition program and employee celebration program, I like to call it. That includes the next line that includes like recognition for years of service. We have some expenses related to new hire orientation. The awareness training, says awareness training, safe personnel. That is the system that we use that some of you may have seen, which is we use to deliver training on harassment, discrimination, and those related topics that we have our folks do every year. And then diversity promotion and recruiting. And that budget is coming down year over year. A part of that due to holding off on spending for Family Fun Day due to not knowing what's going to happen with COVID and which is Family Fun Day is an event that we've had for our employees in the past, but and may look at being able to do in the future, but this year doesn't seem like the year that particular thing is going to happen. So the total proposed salary and benefits budget is $33,145,727. We put the target there as 33.
It's actually 33.6.
33.6. So we're actually, even though it says over target, we're actually under target. So any questions?
Do we have, this is Steve, do we have money in here for safety? I see you have safe personnel, but I know a year or so ago, maybe 2 years ago, we did, active shooter training, that kind of stuff. Do we have that kind of training built into this budget?
Yeah, that is, we do deliver that on safe personnel. We're actually shopping for a new active shooter or active threat training right now. So it includes active threat training and some basic safety training like lifting and that sort of thing, so that folks can try to avoid injury in the workplace. It's a little more, library work's a little more physical than folks think it is. There's some people on the senior team can attest to that. They went out and helped. I've gone out to help in branches recently, and I think everybody remembers how how physical that work is now after spending some time out there. But that's included in what we deliver to staff via safe personnel.
There's also things like making sure you're not distracted. I just finished my battery of training not too long ago, and so it discourages you from walking around and texting while walking through a parking lot. I mean, there's training like that that's part of it. There's also training. We just put out automatic defibrillators in all of our buildings. And so there's training about how to do the defibrillators that's in this training. It's a whole battery of training, as well as auxiliary training. I mean, there's extra training that you can take if you want to find it. And we used it last year for COVID training and, how to clean and disinfect and things like that as well. So.
In addition to that, Dustin, our security manager, he has created training for active threat as well as de-escalation training. So we had all of our staff go through de-escalation training as we were reopening from COVID, as we were going through a reopening process. We've all seen what happens, on the internet and on TV, sometimes with people getting upset about following COVID protocols. And we wanted to make sure that our staff were ready to, instead of ending up on a viral video, that they had some good training on how to de-escalate a situation if if they were to arise. So Dustin has significantly helped in that way, and also helped standardize the training and the information that's provided to staff about safety.
So long answer, Steve, but yeah, but that is included in the safe personnel training, along with a lot of other things too.
Thank you.
Any other questions? All right, we can talk about medical insurance.
Well, not yet.
Vote on this first?
Not yet, yeah. So,
I'm not voting.
so this is, yeah, Jennifer's all excited. She's
I'm not voting.
She's ready to go. But as Joycelyn said, we actually, we work really hard on this to make sure that we do stay below that 60% target, that ceiling for us. We feel like we've worked hard to make sure that some of our expenses were competitive by taking them out to bid to make sure that they're in the right place. There is one thing that I feel is kind of like a hole in this budget, and it's the fact that we've gone a little ways without doing a market study on our salaries to determine if we are staying competitive with our salaries and benefits and job descriptions. But I have a solution for that, and we're going to talk about that in a couple of agenda items. But staff feels very comfortable with this. We feel like we're not growing too fast, and we're holding the line where we need to. And so obviously we are open to any recommendations, suggestions, questions. But what we would like is, if you all are comfortable with this, we'd like a recommendation to the full board for the personnel components of the proposed 21-22 budget, with the correction that Jennifer mentioned right up top, that the authorized FTEs is actually 412 instead of 413. And then the next number would be 418.5 instead of 419.5.
Correct.
I so move.
Okay, thank you, Rita.
Do we have a second?
Steve, I'll second it.
Okay, thank you. I have one comment here, and that is for the benefit of those who may be watching, or for our new members of this particular committee and to the board as well. Our percentages in the budget, with 60% ceiling on personnel, 22% on materials, and 80% on operations. Steve can speak to this more specifically, but as we've looked at this, we found that MCPL is among the highest in our nation in terms of what we allocate for materials, which is our mission, which is getting out there and getting the materials in the circulation and all that. We're among the highest in the nation of that, and we're among the low range in terms of our operating expenses. And so just to keep that in perspective, that while 60% may seem a lot, that we are actually on the high range when it comes to the amount that we spend on actual materials and things on our shelves, available online. And we're also, I believe, still among the number one, or among the top of lenders and borrowers from, you would call that, Steve, the loan, where we loan to other libraries and we borrow from other libraries.
That is correct. Right.
Yeah.
Right. Yeah. The interlibrary loan, where we
Interlibrary loan.
yeah,
Thank you.
resource sharing amongst libraries.
And you could correct me on those numbers, but if my memory.
No, you're right. You're right on target, Joycelyn. We are, for our peer group, we spend more per capita and more per dollars in many cases than any other library on materials. That is, buying books and buying audiobooks and programming and all of those sorts of things. And operations, we tend to be pretty tight compared to other library systems. And our salaries, compared to our peer group, is in the bottom half of that group. Now, one of the things to keep in mind is that our peer group includes a lot of libraries from California and a lot of libraries from New York where the cost of living is higher and there's more unionized workforces. It also includes a lot of Ohio where there's a lot of unionized workforces. So when you begin to take some of those into consideration, I feel like our allocation is if our pie is sliced in three ways, it feels like the slices are done correctly.
I just wanted to point that out as we go to the vote. Do we have any other questions or comments before we vote? And Steve, can you clarify what a vote on this tonight means in terms of our overall budget process?
Right. So this is a recommendation from the committee to the full board. And so what it means is that the committee had an opportunity for Jennifer and I to talk about this at great length, and you had an opportunity to ask a lot of questions. And after that was finished, then you're going to recommend to the full board adoption of this for the budget. And then the full board will actually be the ones that will recommend that or adopt that as part of the budget. So this is just a recommendation tonight. If you go home and see something and think, gosh, we really should change that, there's a couple of opportunities still to change it.
Thank you, Steve.
Mm-hmm.
So are there any more questions or concerns or comments before we go to a vote? Okay, hearing none, I will take a motion.
There's already a motion on the floor.
Yeah, sorry.
Just
a vote.
have to call the vote.
Okay, calling the vote. All those in favor, please say yes.
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 Any opposed? Any abstain? The motion passes. And I will thank you, everyone.
Mm-hmm.
I will pass that back to Jennifer and see for the insurance report.
Yeah.
So just a real quick, I'll tee it up for you, Jennifer. For those of you who are on the board a couple of years ago, we had 2 really bad years and we kept saying, this is cyclical, that some years are good and some years are bad. And this year we happen to have 2 bad years. We've, don't want to steal your thunder, but we've had a pretty good insurance year. And so we wanted to give you the most recent experience report that we got from Blue Cross and Blue Shield. So
we'll go through these slides. These are slides that are provided to us by Blue Cross, and they have a lot of data on them. You're welcome to delve in as deep as you'd like. I'll try not to get too wonky on talking about health insurance, but we can have a conversation all night if you want to talk about it with me. If you want to go to that first slide, that one there. So this first slide is talking about our plan summary, which is our claim, which is how much money we paid out for claims for the previous actually 4 years. So this is telling us 2017 through 2020 and how we've tracked and what that has looked like. As Steve mentioned, particularly in 2018, we had a rough year, as you can see. If you look in the lower left-hand corner, that's just a simple graph that tells us, how many claims we've paid by year. There is an impact to claims because of COVID. So as we go through here, keep in mind that things like elective surgery and some preventive care and outpatient visits didn't happen. But one of the things that we look at with something like that and how it impacts everyone, we look at the benchmark. And in that lower right-hand corner, you can see an amount that we use, that PMPM is per member per month, what our costs were. And for this year, it was $423.82, which is significantly less, as you can see from the previous years. But the line that you see across there is what the PMPM is for our broker Lockton for their book of business. So all of the different kinds of organizations that Lockton represents, we are below that benchmarking for this year. So, and that's always good to see. And that is still with, as you can see in the upper left-hand corner with that graph, that's still with an increase in the number of members as we see as we have increased benefits eligible staff, then of course we're going to see the members on our health plan increase. The upper right-hand corner is just if that's something that you're interested in, we get demographic information about our group because it can impact costs or what we predict costs will be. You can go to that next slide. This is just another breakdown of the member per month comparison. And, again, if you're interested in some of these things, you can see, by age group, by year at the bottom. What you see in the upper left-hand corner is just a breakdown of how much of that per member per month goes towards employees themselves. That's the navy, the biggest portion of it. The gray portion is for employee spouses that are covered. And then the small portion there where we can't see the number is for dependent children. The interesting thing that if you look at the bottom, when it comes to the breakdown of costs per age group, where we saw the biggest drop off, as you can see, is in our 65 plus staff members. And part of that we can attribute to we had a greater number of retirements this past year from benefits eligible staff than previous years. The impact of that was one of the impacts of COVID was if anybody was teetering on the edge of I might retire soon, that this was the year that some of those folks went ahead and decided this was the year to do it. The most interesting thing to me on this particular page is looking at the breakdown of what type of claims make up that per member per month, and that's in the upper right-hand corner. The blue at the bottom is for inpatient visits, so people that are admitted to the hospital, a small sliver down there. The gray is for outpatient services like radiology, lab, preventive things like colonoscopies, mammograms. The red is for professional services, so like for your doctor's visits and things like that. And then the orange is for prescriptions, and prescriptions is where we get hit hard and where everybody gets hit hard. So you can see how much of the health plan expenses come from prescriptions. We'll talk a little bit more about that further in. The next few slides we'll kind of go through quickly, but just to kind of give an idea of why our plan is and our employees, our staff, are doing a good job of being good healthcare consumers. On the next slide, it talks about inpatient utilization. So how many people and how much money did we spend on folks getting admitted to the hospital this year? As you can see, it's below, of course, went down year over year, back to kind of where we were in 2017. But that line tells us on that upper left-hand corner graph where Lockton's book of business is. So we were definitely below the average on how many admissions per 1,000 members that we had in 2020, which also, of course, brought our costs down, which you can see on the upper left-hand graph, down from approximately 400,000 to approximately 200,000. And you can see the breakdown of that that we paid $231,000 in 2020 for inpatient utilization, which is a decrease of 170,000 year over year. And we had 5 fewer admissions. That elective surgery and piece is, if you can see at the bottom, that the second part of that graph at the bottom, that's where we saw that a significant drop off. But we did see the third graph is people having babies, and the fifth graph is for well newborns. So that's where we saw kind of a switch. Those are the places where we saw increases were babies being born and babies being taken care of after they were born. So the next slide is about outpatient utilization. Like I said, this is related to lab work, general radiology, outpatient surgery, preventive care, and like infusion drugs and things like that, having them be infused. Outpatient for everybody was down. this year because of and this does include telehealth visits. The count is there for telehealth visits. You know, a lot of folks switched to telemedicine this year, but there were still fewer visits overall. We are down $300,000 dollar-wise over last year, you know, which helps the plan, the plan costs in general. The next two slides, the first one's about emergency room utilization, and I really like to talk about our group related to this, because if we go back a decade or so and we look at emergency room utilization, we were definitely at average and often above average on emergency room visits per 1,000 by year. And as you can see on the graph here, that we are below, far below Lockton's book of business, that graph there with 124.2. We had 54 emergency room visits this past year, and which comes to $72,000. It is a significant decrease, even just if you can see year over year, and that is you know, a partnership between our staff and the education that we've been able to provide that we kind of really repeat on. We have a wellness coordinator that's been with us for, gosh, we're going on a decade here. And Bonnie, you know, one of the things that she works on educating people about is you know, making sure they have a primary care doctor to take care of their needs, so that when something comes up, they don't end up in the emergency room because they can't get care anywhere else. And so we've been able to make an impact there, and our staff has made an impact there. The next slide is urgent care utilization. So one of the things that you do if you don't go to the emergency room potentially is go seek urgent care. And so we've seen an increase in urgent care visits. The graphs off to the right are interesting because they look like, oh, those amounts have gone up significantly. But if you look at the dollar amounts, it's not that significant. And I as far as the money, because it costs less to go to urgent care. For 2020, it cost about $141 for an urgent care visit on average. And for an ER visit, it cost a little over $1,300 on average. So, you know, just if we just converted, you know, if 25, we had 100 urgent care visits this year, if 25% of those went to the emergency room instead, which potentially is what we would have seen previously, you know, we would have spent an additional $30,000. So we can see the shift in how people access healthcare and how that helps the plan year over year save money.
Yeah, I believe that this is another testament to the good work that Bonnie's doing in terms of educating our workforce to understand that, you know, if you have a unusual rash and you really can't take care of it anymore, don't go to the emergency room, go to an urgent care.
Yeah. Don't go to the emergency room for your strep throat, different things like that, things that we've talked about. The next slide, next couple of slides are, we won't go super deep, but we do want to talk about high cost claimants. And mainly because of that breakout box that you see there in the upper right-hand corner. High cost claimants are those with claims greater than $50,000. That's what's getting reported out here. Since we are cost plus, since we do pay our own claims, we do have reinsurance, which means we have a deductible, and if an individual's claims over the course of the year reach that deductible, then we have reinsurance to pay for the rest of their claims throughout the year. Our deductible or pooling point is $75,000. So we monitor high cost claimants so we can see if there are things that we can do to help people not be in this group, because 1.7% of our accounts, of our membership accounts, account for 31.7% of our claims costs or in our plan costs in the last 12 months. So the high cost claimant is a pretty significant impact on plan costs. We did have reason why 2019 ended up being a bad year, or worse years. We did have a lot more claimants. 2018 was worse because we had fewer high cost claimants, but they were more expensive. So But the portion of that per member per month figures that we were looking at before, that's around $430 for this last year. 134 of that is for high cost claimants. So, we want to look at if there's a way that we can have an impact on that. And we always see something interesting here. If you go to the next slide, and again, we won't go super deep here because it's a very detailed visual that you can see there that they use to kind of break down, what kind of conditions we're seeing. So if there's something that we can impact, with education or wellness or something like that, that we can work on that. And then the bottom is service type. The struggle that we have currently is that, and you can see it even in the pie chart over to the right, is that we have a significant amount of our high cost claimant dollars being spent on specialty prescriptions. And this is because there are certain medications that folks need for conditions that there's only one option. And in the way our market is set up, our healthcare market is set up, then those companies, those pharmaceutical companies that have that medication, as we've seen in the news multiple times, can charge whatever they want for it, and they do. And even with insurance companies contracting with them, looking for ways to save money, there's just some of those medications that are going to remain expensive until there's another option available. And that, accounts for a significant portion of the big orange square in the bottom, the orange slice of the pie over there, and provider names. When you look in the bottom corner, Express Scripts, which is our specialty pharmacy distributor, the greatest amount of the money on high cost claimants goes towards prescriptions and specialty drugs.
But I just really want to clarify this and make sure that you understand. It's not that we're just throwing up our hands and saying drugs are expensive. I mean, what's really driving this is that we've got a handful of very specific drugs that doctors
treat very specific, in most cases, rare conditions. Our cancer, they did point this out in our meeting with Blue Cross, that our cancer rate for our staff is, knock on wood, is lower than average. But we do have, some, conditions for folks that are just rare, and there's not really something you can point to that, that we could have done to help with wellness, or choices they could have made.
Going to a generic.
Yeah, or going to generic, that these are just not, these aren't options for those folks. And so that's where we can see the impact of that. The next slide, real quick, just for curiosity's sake, this is the summary they gave us for COVID-19 for our plan. We had 182 members with claims. That doesn't mean we had 182 members with COVID. Anybody who got tested for COVID through their doctor's office, an urgent care visit, whatever that might be, was a COVID-19 claim. They did include the codes down at the bottom. So if we wanted to do medical coding research, we could find out exactly what those were for. There was 434 claims, and it cost the plan a little over $46,000. And again, in our meeting, the doctor the medical director person who did our Blue Cross meeting this time said that's as low as he had seen. So we feel fortunate there as well. The last part, we're talking about prescription drugs, so we're going to talk about them a little bit more on the next slide. When we're looking at how can we, are there places where we're doing okay, places where we could do better. Our total plan cost for our pharmacy for our drugs has gone down almost 10% year over year. And even more when you're looking at per member per month, it's gone down 12%. That's a pretty good indicator. I think it says that here somewhere of what our trend is, which is good to see. The claims dollars per member per month is up, like claims amount, sorry, how many claims per member per month, how many they actually make, not dollars, is pretty flat So it's 1.60 claims per member per month versus 1.58 the previous year. It's just up 1.3%. Our specialty drug cost as percent of plan has gone down. So the previous year it was 40%. It has gone down to 28.3%. So anytime we can see a decrease there, that is good, because specialty drugs, they say specialty because they're special. And if it's special, it's likely more expensive. And we have a decent generic dispensing rate of 84.4%, which is an increase again. And this has gone up a little bit every single year. On the next page, the next slide, this is the last one. This gets super wonky, but this is benchmarking for pharmacy. So we can just kind of see if there's places where we have an opportunity to potentially save our staff or the plan money on prescriptions. There are places where we are definitely doing better than average, like our plan cost trend. The plan costs for a 30-day supply of medication. And then one of the things where we know that costs more than average is our specialty plan cost per prescription, which is about 6 or 7 lines down there, and it's $5,600 versus a $5,000 average. Our generic dispensing rate's doing really well. It's catching up with book of business. We've been lower than that before. It brings up mail order dispensing rate, which is below the average, but the way our plan is set up, there's not a lot of money savings necessarily for mail order over walk-in pharmacy. We are going to do a couple of things likely this year. We're going to work with Blue Cross's RX savings plan that individual members can sign up for. We're going to get some more information out about that, show them how they could save money by changing the pharmacy, by talking to their doctor about switching to a generic or trying a less expensive medication. And we are going to look at adding the 90-day dispensing at the local pharmacy instead of having to do right now. If you want 90 days dispensing, you have to go through mail order, and this is not just a convenience, but it would still offer the kind of savings that mail order offers, but with in-person convenience, which means people are more likely to use it, and then we'll save the plan money with those 90-day dispenses versus 30-day dispenses. So that's all the nerding out I have about medical insurance.
No, so it's a real deep dive on the medical insurance, but medical insurance has been an Achilles heel for us. And it's also a big expense, as Rita's mentioned. So, and an important expense in terms of how we compensate our employees. But we sort of bemoaned our bad news. And so thought it might be good to talk about some of the good news when we have that as well. So
Definitely. Any questions?
Jennifer,
Yeah.
we're according to our budget going to add 45, 50 people next year. How will that affect, you think?
We know that it will likely, have an impact, but a lot of that, gets smoothed out with turnover and, gaps between hiring. So, we've gradually increased the number of members on the plan year over year, but even with that gradual increase, we've been able to control costs. So, and I know we've talked previously about like how many staff member numbers we are down. But that only is of that number, that's only about 25 or 30 full-time staff. Most of the staff numbers that we are down are part-time or half-time staff that aren't covered on the plan. So, excuse me. So yeah, we would expect to see more, Steve, and we are going to continue to watch it, of course, and try to keep doing the things that work well, and potentially add some things that could make things better and help. We have been really fortunate, even with a bad year or two thrown in there. So.
Yeah, you guys have done a great job. This is very amazing. I guess my last question is, you spent a lot of time on wellness training for our staff. Has that paid off?
Yeah, I think that without a doubt, we've had the same wellness coordinator previously as a contractor through St. Luke's, and who is now our employee. Her salary is covered by a wellness stipend that we receive from Blue Cross, and she is. Someone the other day commented and said she's the goodwill ambassador. She spends a lot of time, educating and communicating with folks, but also because she's been here long enough, building relationships with staff so that they feel comfortable coming to her to help them navigate or manage things that, may be more personal. And she provides an avenue that they are comfortable with to say, hey, this is happening. What should I do? Or I saw this and to share ideas with her and help. And that to me is one of the biggest and best investments that we've made with money. We could have bought, gift cards for people that walk 10 miles. We could have done some of these things.
Membership.
But the relationships that Bonnie has built with staff over the time that she's been here has been a worthy investment. And I think that we can see that she has been an active part of our HR team when it comes to looking at our health insurance costs and then what's feeding those health insurance costs. So we look at, chronic condition management, all of those things. So, yeah, I would say that the short answer, Steve, is yes.
Thank you.
So this was just an information item. There's no vote or anything, but like I said, just thought we would share good information when we had good information to share. So we can move to the next agenda item, if that's your pleasure.
We can do that.
Okay.
Let's go on to the 2021 fund balance.
Okay, so, and we can just go ahead and go to the next slide. This chart that you're seeing is part of a chart that the Finance Committee looked at. So I will start off by just starting at a real high level at a handful of things, realizing that the Finance Committee really dug into all of these topics in a big way. But basically what happened is, as you remember, this time last year, we were just starting with the pandemic. We had no idea how it was going to work. We knew that we probably needed to slow spending, and we did. We knew that we probably should anticipate lower revenues, so we did. And we did things like the hiring freeze that we talked about before. We did a lot of different things. In terms of the way I like to talk about this, I'm a big believer in the 80-20 rule, that everything just sort of almost breaks in that 80-20 way. And in our case, we put forward several different tactics to try to hedge our bet because we didn't know what was going to happen with COVID-19. And of course, you've seen in the newspaper, lots of cities are having revenue situations. And one of the reasons why we did not have the same revenue situation that a lot of cities and counties had is because we don't rely on sales tax. And so many folks, stopped going to stores and buying things from Amazon, which meant there was no sales tax coming in for those folks in many cases. And that didn't affect us, or affected us in a different way. So in terms of the 80-20 rule that I kind of live by, I figured that we'd have a whole bunch of tactics. 80% would work, 20% wouldn't work, and it would kind of work out in the end. What ended up happening is that almost all of them worked. I can't come up with one of our tactics that didn't actually work. And so because of that, we loosened up on our hiring freeze and we started doing some other things, but we have a significant fund balance. We're going to have money left over. And so what we did is we talked to the Finance Committee about what should we do with this to try to get this at the right level. And the first thing, and I mentioned this as we were going through the budget, that the Finance Committee recommended transferring $4 million that, normally they would do $2 million last year, and $2 million this year. And what they recommended doing was taking $4 million from that fund balance to kind of make up for those two payments that they would normally do. There were some other transfers, but there were 3 transfers that they don't require any sort of vote or anything. This is really just transparency. And I want to explain to you what it was that we were looking to do. So the first one, that when we get to personnel, sort of a personnel expense, is personnel salaries. And so Jennifer and Quan and I were looking at this, and the whole team. We looked at maybe spending up to $1 million. And if we took $1 million of our fund balance, it would actually fund a $750,000 pool for staff and all associated payroll costs like payroll taxes, Social Security, et cetera. And then this fund would actually equal a 3.75% payment to employees who were on payroll based on their average numbers worked from May 20 to April 21, and will be paid as a one-time payment. So it's not being added to their salary. It's just a one-time payment in May of 2021. The purpose of the payment is that we asked our staff to do a lot of things. As we came up with all these tactics to try to save money and cut corners, they figured out a way to do it, and they were successful in doing that. So the purpose is to show a system is to share in that system-wide savings that our employees helped us achieve during the pandemic, and to show them appreciation for doing what they did to help us come out of this in a positive way. So that is one of the ways. It's a personnel expense. It's in the personnel budget. Because we had the hiring freeze, we have all this money still in the personnel budget. And so that's one of the things that we're looking to do. The next thing that we're looking to do that involves personnel, I mentioned before that we hadn't done a salary compensation study in a long time. And Jennifer and I had been talking about doing that maybe next year, maybe in FY 21-22 or 22-23, as well as a reevaluation of our job descriptions, making sure that they are following best practices, making sure that there's nothing in there that is violating a federal regulation that we don't know about, or something like that. So basically a survey of both of those things. We would plan on doing those anyway, whether it was FY 21-22 or 22-23. But because we have the money in the fund balance, we're looking to actually get that contracted and that work underway this summer. We believe that will cost no more than $150,000. In fact, may not cost that much, but that's our plan to assure that we're compensating correctly, we're market competitive, and that our job descriptions are where they need to be. The third area that really I think affects personnel, or affects the work of this committee, that I really wanted to underscore is the third from the bottom, where it says professional services operations, $50,000. And what this is these are 3 process improvement studies to be performed by an outside industrial engineer. And that engineer is John Huber. He's somebody we've worked with several times. And what John will be working on, his scope, is to work on 3 different service delivery chains to ensure that our process is correct. I mean, he's an industrial engineer. He's the type of guy who goes in and says, are we doing too much duplication of work? Is this something that we could shorten, and all of that? And you might remember that some of John's previous projects, his holds processing project that he did for us, documented a $600,000 a year savings. And so those are the types of things that John can do for us. And so the 3 areas that he is looking to work on is he's going to come back in and look at our technical services department. He's done that before, but he wants to double check and make sure we haven't backslid. And I think his savings at technical services previously was around $400,000. So he wants to make sure that we're still doing the right things there. He wants to take a look at our holds processing again and make sure that we're still doing the right things and we haven't slid backward there. And then he's also looking to create a full evaluation of our community in-person programming to make sure that our processes involved there are correct. This is a service that developed slowly over time. And so we just kept adding components to it. And you know how it is. Lots of times when you add one component and add another component, you forget to take away something that's inefficient. And that's what John helps us identify. So the reason that I bring that up as something that potentially has to do with this committee is that this does actually correlate with one of the annual goals that was agreed to back in January. We always do look to do process improvement as part of the annual goals of the senior leadership team. And so this is going to help accelerate that as we look at 3 different service delivery chains, not just one, as we would normally do in a given year. And so, like I said, all 3 of these particular lines, the 1 million for personnel, the $150,000 for the salary study, and the $50,000 for professional services, which is technically in operations. All 3 actually correlate with this, with the charge and work of this committee. All 3 of them are essentially in operations, and according to Quan, all 3 basically fall within the existing budget. So, and we did talk about all of these as well as the other things on the chart with the finance committee. I'm mostly bringing them to you tonight. No need for a vote, but bringing them to you tonight in terms of transparency, just so you can know what it is that we're planning to do with the fund balance, and to answer any questions that you might have about what we're doing, why we're doing it, and how we came up with what it is that we're doing. So I'll pause right there. There's one more thing that I want to talk about in terms of compensation, but I want to pause here in terms of the fund balance and answer any questions that you all might have. I'm not hearing anything. I can certainly answer questions later and certainly open for emails, phone calls, and all of that. The last thing that I would like to talk about before we move off of agenda item number 7 is performance payments. Now, the senior leadership team, if you remember back in January, this committee talked about the performance goals for the senior leadership team for the year 2020. And there was a decision that the committee made. In fact, if you want to flip back, I believe that it's in your minutes where you all talked about that, and you also talked about the potential allowance for this. And there was my contract essentially says that me and my team are eligible for performance pay, and we talked about it, and we determined that we really didn't achieve the goals that we set out in 2020. Due to the pandemic, we weren't able to do everything that we thought that we should be able to do. But there was actually a motion that came out that said that there was an expression of appreciation of and value of the staff's efforts and acknowledgement of 66% of fulfillment as a tentative decision. Payment for performance for a final decision on the award amount will be determined by the end of the fiscal year, determining the fiscal status of the library. So my team decided that we were thankful that you had awarded us a 66% fulfillment, but decided that we wanted to forego that until we understood what the fiscal condition of the library was going to be. Fiscal condition of the library is in very good shape right now. And so what I would like to ask is if the permission to release that withhold, because I feel like we can afford it, and I feel like it's not sending the wrong message to our staff now to go back and award the senior administration for the goals that they attained in 2020 and that we can now afford. So,
If
yes.
if I can clarify that.
Please.
We have already voted on the amount and the award. We did say, let's take a look at the funding towards the end of the year, and if there was funding available, that could be awarded. What I believe you're asking is not a vote. You notice on the agenda, there's not an asterisk for that. What you're asking right now is basically, hey, remember we said this. I'm letting you know now that I have made the determination, and you're really giving transparency to the board to say now is the time, when that can be released, and giving us a chance to affirm that.
Yeah, that is correct. I mean, really, if you look at you can see it right there on the minutes on page 8. I mean, that this was agreed to by the committee. It did go to the full board. The full board agreed in the same way. But the release of the award was all contingent on the fiscal condition of the library. And staff is suggesting that we can afford this, and it would be the right thing to do at this point. It was not the right thing to do in January. And so yes, Joycelyn, you said it much better than I did.
It's okay. You're in a weird spot to do that.
Yes.
I guess the way I would kind of see us going forward is we cannot do a vote. What I would like to do is open it up for a discussion if needed, or questions, so that you can have clarity about where the board stands on our fiscal position to award this performance, pay for performance. Does that make sense?
Yes.
Board?
Steve, how many people will be affected by this, and what's the kind of the total dollar amount we're talking about?
Yeah, Jennifer, you may actually be, as I tap dance a little bit, you may be able to get the total dollar amount. But the total amount of people that we are talking about is 9, 3 of which are sitting in this room. But it's the senior leadership team. It's the people that you're used to seeing. Susan Ray, actually probably the remaining 6 are on the telephone line. But it's the senior leadership team. And what it's amount to, as I recall, was it 4%?
1.6.
No, that's wrong. That's wrong. It's going to, I'm sorry, Steve, it's going to take us a little while to get that actual.
Okay, while you're
But we'll do
calculating that, Steve, I'd like to remind everybody that what we're talking about is the pay for performance that is actually awarded to the rest of the staff back in July
1st of 2020.
July 1st.
Right.
The leadership team is tied to performance attainment goals, which is tied to the fiscal year, but it relates to the same time frame as the rest of the staff. So we've actually postponed that another 6 months for the senior leadership team. Is that right, Steve?
Mm-hmm. That is correct.
And it's a total of about $18,000 this fiscal year.
I believe that's money well spent.
I think so too.
And I think with the money, as we said last time, and you sent out a very lovely note, Steve, to the staff on behalf of the board, but we went through some unprecedented stuff the last year, and to come out intact, building new libraries with a little bit of a budget surplus. Surplus is the wrong word, but a budget that we can have some flexibility rather than just simply have to cut all the time is a hell of a job. And so I think you probably earned this bonus more this time than you have in lots of years. So congratulations to you and your senior team.
Thank you, Steve.
Thank you. I actually found another little bit of data that I was looking for before. So basically what we determined is that you were awarding me 66% of my performance pay. The total pool, this is getting way into the weeds, but the total pool for all employees is tantamount to 2.75% of their total salaries. And so 66% of 2.75% equals one, what meant that the senior leadership team, their pay for performance bonus that we're talking, not bonus, bonuses are not legal. Their pay for performance one-time payment is equal to actually a 1.84% increase.
It's not a one-time payment though.
Oh.
Yeah, that's why it's,
Oh, yeah, for some folks, it is actually going to be applied to base.
that's why it's lower than
That's right. Mine is actually one time.
one time.
Yours is actually applied to base, and that's why it's 1.84. Yes, correct. Sorry, it's a little complicated, but
We try not to be complicated, but yeah.
in order to be fair, we have to be complicated. Okay, so, yeah, what I'm hearing is I'm hearing that there is sentiment to go ahead and that if staff release this, that would be okay.
I would say it's not only okay, Steve, it's well within the intent of our actions back in January. And this is just a review of where we are, and we trust it and support your decision to release those funds, those well-deserved pay for performance to our senior leadership staff for a job well done.
Thank you.
Anything else in item number 7?
That's all for 7.
Okay, is there any other business? Do we have any other business, Steve? I don't have any.
Staff has nothing else, no.
Okay, then I will take a motion to adjourn. Oh, yeah, motion to adjourn.
You're asking for a motion to adjourn? Is that what I heard?
Yes.
That's what you're hearing, Steve.
Okay, we got a motion. Do we have a second?
Second.
Okay, we got a motion and a second. All those in favor, please say aye.
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 Aye.